back. This is Boomer Life on CL 650.
Welcome back to the program. I'm Sterling Fox. On the line with me from False Creek Healthcare Centre in Vancouver is their medical imaging director, Dr. William Yee. Dr. Yee, just before the break, you identified a number of scans, and you started to talk about hearts and lungs, and I didn't get a chance to finish off the part of the conversation about lung scans. I asked you if you do them, and you said, yes, we do. Give us a typical example of why a person would come into False Creek Healthcare Centre seeking specifically a lung scan.
Well, first of all, lung cancer is the #1 cause of cancer death in both men and women in North America and actually in worldwide. If left untreated, this growth or tumor can spread beyond the lungs by a process known as metastasis. The vast majority, about 80 to 9% of lung cancers are due to long-term exposure to tobacco smoke.
Okay.
However, 10 to 15% of cases occur in people who have never smoked in their life.
Really?
Yes, exactly.
So is that the secondhand smoke stuff, do you figure?
Exactly. It may be due to secondhand smoke, radon gas exposure, asbestos, other forms of air pollution, and also genetic factors.
Okay, but
Right.
here we are now. We're talking. This is Boomer Life, and a lot of my contemporaries have smartened up in their advancing years and quit smoking. But a lot of us were dumb and young once and smoked like chimneys when we were in college and all the rest of that. Once one abandons that nasty habit and improves one's life, how many years go by before you start to level off and your risk goes back to the point where the same as if you'd never smoked?
Okay, now now you're asking me about screening for lung cancer.
Yeah.
The only recommended screening test for lung cancer is low-dose computed tomography, also known as low-dose CT. In this test, a CT scan scans your chest with a low dose of radiation to make detailed pictures of the lungs. Now, who should be screened? Well, the U.S. Preventive Service Task Force recommends yearly lung cancer screening with low-dose CT for people who have a history of heavy smoking, and also patients who smoke now or who have quit within the past 15 years.
Oh, okay. That was the number I was looking for.
Yeah.
Okay.
And they're aged between 55 and 80 years old. Now, what do I mean by heavy smoking? It means a smoking history of 30 pack years or more. And what is a pack year? Well, a pack year is smoking an average of 1 pack of cigarettes per day for 1 year.
Uh-huh.
For example, a person who has a 30-pack year history of smoking smoked, 1 pack for 30 years, or he smoked 2 packs for 15 years.
That's a lot of smoking.
That's a lot of smoking.
Holy cow. Okay, well then obviously a person with that kind of history is definitely going to be a prime candidate for a lung scan, aren't they?
Absolutely.
And is the lung scan process is exactly the same as the others that you've already described to us?
Yes, it doesn't require any intravenous contrast. It is you come to the center, you lay down on the CT scan, and the table slowly moves you through this donut, and this rotating radiation source goes around your body, and we produce high-resolution images of the lungs. And when should the screening stop? Well, the task force recommends that the yearly lung cancer screening should stop when the patient turns 81 years old, or if they have not smoked in 15 years, or if they develop a health problem that prevents him or her to having surgery if we do indeed find a lung cancer.
So the magic number is 15. If you've
Right.
if you've been off the bad weed for over 15 years, chances are you're as healthy as you're ever going to get
Right.
in terms of having all of that stuff out of your system.
That's right. Well, the stuff will be in your system, but your risk will not be really, really high.
Interesting stuff. Talk to us about some of the other scans. Now, you hear every now you see a thing in the paper where somebody went and had a full body scan. What's that all about, Dr. Yee?
Well, a full body scan is more of a screening exam to determine if there's any anatomically discernible disease processes in your body. And at False Creek, we do offer a full body scan, but that is really tailored to using the best modality for imaging that particular part of the body. So we use an MRI to image the brain, the entire spinal cord, including the neck, the chest, and the back. We use MRI to image the organs within your abdomen and pelvis. CT is actually used to look at the lungs because it's the best study for that. MRI is not very good for looking at lung tissue because there's just not enough protons, those little hydrogen atoms spinning around in your lungs to provide a good signal.
Okay. So the process is not terribly complicated and yet immediate. You can pretty much get results after a scan within a matter of minutes, can't you?
Absolutely. Yeah.
And that, I imagine, is again, we've referred to the peace of mind factor a few times here. And you know, if you're not feeling well, and this is progressive, and you've been sort of going around and around and not get any answers, and finally, at least if you go and you have this test done, this incredibly sophisticated, non-invasive test done, you can, with a little bit of luck, find out at least what the heck's wrong with you in a matter of hours, if not minutes.
For sure, and sometimes we often combine a CT colonography exam to look at the colon.
Okay. That sounds a little less unpleasant than the old colonoscopy that we all make jokes about, but some of us have to go through.
Absolutely. CT colonography is also known as virtual colonoscopy. It uses low-dose radiation CT scanning to obtain an interior view of the colon or the large intestine. Instead of an invasive procedure with an endoscope, the colon is first cleansed the day before, and when you arrive to our facility, we fill the colon with air to distend it, and then we take some CT images through your entire large bowel. Now, the major reason for performing CT colonography is to screen for polyps or cancers in the large intestine.
Okay.
Now, the goal of screening, again, is to find these growths in the early stages so they can be removed before cancer has had a chance to develop. Now, the American Cancer Society recommendations are that screening of the colon should occur beginning at around the age of 50.
All right.
Right.
And is this an annual event? Is that the recommendation, Dr. Yee?
The recommendation is it should be offered every 5 years.
Okay, right.
Particularly individuals at increased risk or with a family history of colon cancer, they should start screening at age 40 or younger.
I see. Okay, and beyond that, once a year, just to be safe.
Well, every 5 years, if you're at high risk, you may have a shorter screening interval.
Okay, that's what I'm thinking,
That's right.
and that would be determined after the first exam, wouldn't it?
Yep. Absolutely.
All right. So in terms of listening to all of this information, wonderful information, Dr. Yee, we're very grateful for your time. You've really helped us to understand, I think more than anything else, a lot of the amazing technology that is available to physicians like yourself, and the fact that at False Creek Healthcare Center you have all of this technology, all of the talent surrounding it, and then all of the support staff for once the diagnosis is obtained, well, then we have people who can help you regardless of what the diagnosis turns out to be. That's rather sensational, don't you think?
I would agree with that statement.
Kind of a fun team to be part of, isn't it?
It's a fantastic place to work with, and I'd invite you to come over here and see our facility. It's state-of-the-art, and it's a really friendly facility, and we are really dedicated to a great patient experience.
Dr. William Yee is the Medical Imaging Director of False Creek Healthcare Center. Thanks so much for your time, Dr. Yee. A real treat having you on Boomer Life today.
Thank you very much for having me.
My pleasure. See you next time here on Boomer Life.